Good day, everyone. I am Aldrich Faith E. Peligolo, and for today we shall be learning about respiratory system. The respiratory system is one of the many organ systems that works to keep our body alive and healthy. It is a biological system that consists of organs that are responsible for the exchange of gases in animals. The process starts with breathing, inhalation and exhalation. Inhalation is a part of breathing where the air is taken into the lungs by creating negative pressure by the contraction of respiratory muscles and diaphragm. And exhalation is a part of breathing where the air is drawn out of the lungs by the relaxation of respiratory muscles. Now, let's look into the different parts of the respiratory system. We have the nose, nasal cavity, mouth, pharynx, larynx, trachea, the lungs, diaphragm, bronchial tubes, bronchioles, air sacs, and the capillaries. Next, let's call on Mr. Eddie Eno to discuss how some of these organs work.
The nose and nasal cavity form the main external opening for the respiratory system and are the first section of the body's airway. The nose is a structure of the face made of cartilage, bone, muscle, and skin that supports and protects the interior portion of the nasal cavity. The nasal cavity is a hollow space within the nose and skull that is lined with hairs and mucous membrane. The role of the nasal cavity is to humidify and warm the inspired air. As the air passes through the nasal cavities, removes minutes of airborne particles and other debris before the air reaches the lower airways. Air exiting the body through the nose returns moisture and heat to the nasal cavity before being exhaled into the environment. The mouth, also known as the oral cavity, is the secondary external opening for the respiratory tract. Most normal breathing takes place through the nasal cavity, but the oral cavity can be used to supplement or replace the nasal cavity's function when needed. Because the pathway of air entering the body from the mouth is shorter than the pathway for air entering from the nose, the mouth does not warm and moisturize the air entering it. And for the rest of the parts of the respiratory system, Miss Cabernet will tackle.
Good day everyone, I am Cabernet Noemi, and today I am going to talk about the descriptions of the pharynx, larynx, and the trachea. First is the pharynx. The pharynx, commonly called the throat, is a passageway that extends from the base of the skull to the level of the sixth cervical vertebra. It serves both the respiratory and digestive systems by receiving air from the nasal cavity and air, food, and water from the oral cavity. Inferiorly, it opens into the larynx and esophagus. The pharynx is divided into three regions: the nasopharynx, the oropharynx, and the laryngopharynx. Larynx. Larynx, also called voice box, a hollow tubular structure connected to the top of the windpipe. Air passes through the larynx on its way to the lungs. The larynx also produces vocal sounds and prevents the passage of food and other foreign particles into the lower respiratory tracts. The larynx is composed of an external skeleton of cartilage plates that prevents collapse of the other structure. The plates are fastened together by membranes and muscle fibers. The front set of plates, called thyroid cartilage, has a central ridge and elevation commonly known as the Adam's apple. The plates tend to be replaced by bone cells beginning from about 20 years of age onward.
So, let us now proceed to the next presenter.
Hello, I'm Nika, and I will be explaining to you the bronchial tubes, the lungs, the diaphragm, and how they work together. So, beginning with the bronchial tubes, these tubes are the largest tubes that branch out from the trachea to take air into the lungs. When they reach the lungs, they split out into smaller branches called bronchioles. These tubes let air in and out of your lungs so you can breathe. Now, the lungs are two organs situated within the thoracic cavity of the chest. It removes oxygen from the air that you inhaled and passes it into your blood. From your lungs, your bloodstream delivers oxygen to all your organs and other tissues with the help of the diaphragm. Now speaking of the diaphragm is a thin dome-shaped muscle that sits below your lungs and heart muscle. It is what helps you inhale and exhale. Now I present to you Ms. Sheen Perpetua. She will be discussing the other parts of the respiratory system.
I am Sheen L. Perpetua and I'll be the one talking about bronchioles, air sacs, and capillaries. Bronchioles, a part of the lower respiratory system, which is the passageway of air inside the lungs that branches off like a three limbs from the bronchi. This is where the air flows from the trachea after being inhaled through the nose or mouth. Bronchioles are very tiny, ranging from 0.3 to 1 millimeter in diameter. Its function is to deliver air to the alveoli in the lungs. Air sacs, which are called alveoli, the tiny air sacs at the end of the bronchioles, where the lungs and blood exchange oxygen and carbon dioxide during the process of breathing in and breathing out. When you breathe in, the alveoli expand to take in oxygen, and when you breathe out, it shrinks to expel carbon dioxide. Capillaries, very tiny and delicate blood vessels that exist throughout our body and deliver blood, nutrients, and oxygen to cells in your organs and body systems. They work in different ways to support organs and systems functioning. They are also the ones who complete the circulatory system by connecting arteries and veins. There are 3 different types of capillaries that have different shapes, namely continuous capillaries, which have a lining that only small molecules can pass, fenestrated capillaries, which has small openings enabling the rapid exchange of substance, and lastly, sinusoidal capillaries that have small fenestrated, allowing substances to pass through. The next presenter will be Cabizares, who will talk about common diseases and how to prevent them.
Hi, I am Glory V. Cabizares and I am going to give some diseases of respiratory system and how to prevent them. First respiratory disease is chronic obstructive pulmonary disease, or what we all know COPD. If you are a smoker or inhale tobacco in any form, you are most likely to suffer from this disease. Sometimes, chronic obstructive pulmonary disease can also be caused due to genetic reasons. There are some symptoms of COPD: shortness of breathing, wheezing, and cough. Possible treatment would be smoking cessation and pulmonary rehabilitation. Pulmonary rehabilitation is a program that focuses on nutritional counseling plus teaching you breathing and exercise strategies. Second respiratory disease would be asthma, the condition that happens when your airways become narrow due to inflammation. The situation makes breathing difficult and may sometimes lead to producing extra mucus. Possible symptoms are dry cough, tightness in chest, whistling sound while exhaling, and fatigue. And here are some treatments. First is to take long-term medication to manage asthma. Second is to do breathing exercise. And third, to get bronchodilators through nebulizer. The third respiratory disease is what we call lung cancer. Cellular damage caused by inhaling a harmful chemical for a long term can eventually lead to the cancer of the lungs. While the tumor begins in the lungs, it can go on the lymph nodes, bones, brains, and then the liver as well. Symptoms are cough, shortness of breathing, wheezing, chest pain while you laugh, cough, or breath, tiredness, and weight loss. As for the treatments, once diagnosed, you will be required to undergo surgery, chemotherapy, immunotherapy, and radiation therapy. These can be done all alone and in combination according to the severity of your cancer. You can also add in natural treatment options like yoga, acupuncture, hypnosis, massage, and meditation. As you can see, respiratory system have major impact of our overall health. As you already know, breathing is kind of important. So to have a better and healthy future, do take care, eat healthy diet, and maintain an active lifestyle. In this video, you learned about respiratory system, its parts, how it works, some possible diseases and preventions. Take a deep breath, enjoy life, be healthy, and enjoy learning.